Hello, thank you for joining us on the Pain Pod. I am here today with Judy, a patient of Dr. Kim's. Shout out to Dr. Kim. We're here today to hear her story and listen to her patient testimonial. So I will jump right in with our first question. Judy, can you introduce yourself and tell us a little bit about your life?
I certainly can. My name is Judy Burton. I'm retired. I worked for Anthem Blue Cross Blue Shield for almost 50 years. Um, I've been dealing with chronic pain since 2014. I'm not sure how it started. I did have a neck fusion back in the 90s because I was having trouble, pain in the neck, literally, migraines. And I went to a surgeon, went through physical therapy, and then they ended up operating on my neck. They replaced C4, 5, and 6. And I really got about 10 to 12 years out of that. And in 2014, I was rear-ended in an accident. It wasn't a lot of damage, but I felt it. And the only thing that happened was I had a little pain in my left arm. Then about a month later, I started in with the pain at the base of the neck, and it radiated through the shoulder. And I started looking for doctors and going through the process of physical therapy, having MRIs. And each time I'd go, they'd say, well, you've got a lot of degeneration, you've got a lot of arthritis, but we really don't think we need to go in there and operate. So I ended up settling with a pain manager, and I think I went to him for about 7 years, and maybe longer, I guess. I can't remember exactly, but he was very nice. He was very good. They tried injections, facet injections, different treatments, and nothing really seemed to work. I started out on the lowest opiate that you can take, and then I graduated to the stronger opiates over time. And I did physical therapy, but a physical therapist told me, I really don't want to mess with your neck. It's too risky. When you have trouble back there, I don't want to cause any type of damage. So I ended up staying on the opiates and just trying to cope with daily life. And I might get 2 or 3 hours out of the day where I felt really good, sleepy, drowsy, the other side effects that come with opiates. So then my doctor retired. And I thought, oh my goodness. So they gave me 3 recommendations. And I went out and watched Dr. Kim's podcast. And I thought, he seems knowledgeable. I like him. Because I think in the one, he wore his little surgical cap. And I thought, he really doesn't care. He's there to help people. He doesn't really care about, this is how I look. I'm going to look this way and look all glamorous. And he said, I've read everything. And then he said, you have a choice. You want to stay on these pain meds the rest of your life, or do you want to try another treatment? And I said, I'll do whatever you tell me, whatever you recommend. So, with that said, I still stayed on the opiates. He did not immediately jump into any other treatment. He did try some injections. He also tried an ablation, which worked some, but I was still in that same mundane rut of depending on opiates and not functioning. So I was supposed to have a visit with Cora. And to my surprise, he walked in. And this was about a year after I had been at the clinic. I think I started going in 2024. And I was really surprised to see him because I said, oh, is Cora ill? Is she on vacation? He said, no, I want to talk to you about a pain pump. And I said, a pain pump? And he said, Judy, I've looked back at all the assessments that you've been doing for the past year, and everything is the same. You never change. Your score is always an 8. It's the medicine is not effective, and your quality of life is poor. And when he noticed that my quality of life was poor, I thought, this is a doctor that listens to me. He knows what I've been through. And that was really, really impressive to me. And I must say that the surgery center was wonderful too. They've always treated me with the most respect. And I had the procedure. And you know, sometimes when you have a procedure, you expect results right then and there. Oh, this is going to take care of everything. Once again, Dr. Kim followed me like a little hawk through this. And he warned me. He said, Judy, now I'm going to gradually increase the meds that's in your pain pump, but don't expect your pain to end overnight. And you still may have some pain. But as I gradually went along, and I think it was about November, I told him, I said, oh my goodness, I'm getting about 6 to 8 hours. I'm pain free. And I said, I can do things, I can cook, I can clean, but in moderation. Because if I do too much, then I'm in the same position to where I hurt. And so I rest. But I feel like because of Dr. Kim, my quality of life is so much better. And I'm 78 years old. And I want to be able to enjoy my grandchildren. I want to cook. I want to clean. I want to go on vacation. And I feel like now I have that opportunity.
Well, Judy, thank you for sharing all that with me. And I am so glad to hear that your life has improved so much, quality of life especially.
Thank you.
So we have a lot of patients who are in a similar situation as you and are considering the pain pump or in conversations about it. Can you tell us a little bit about, your process with that, how that recovery process went for you? What has the pain pump been like for you?
Well, actually, the placement of the pain pump, the surgery itself, was very impressive. I may have been, I don't know, anesthesia, maybe an hour and a half. Recovery was great. Usually after anesthesia, I become nauseous, and I wasn't. I really didn't even feel pain. I mean, you always feel a little pain after incisions. Right. But what alarmed me the most, I told Dr. Kim, I said, that's a big bump back there. What am I going to do? And I said, it feels funny. Oh, no. He said, it'll callus over. You won't even notice it after a while. Well, this was in September. And probably about November, I got used to it. My husband helped me. You have a little pain manager. I forget what it's called, PTM, I think, anyway. And you get used to using this and giving yourself, if you need extra doses of medication on the pain pump, you are allowed to do that, up to 4 a day. And it's really cool because the pain pump will tell you the time on there. So if you're too early and 6 hours hasn't lapsed, it'll let you know that. Nope, you've got another hour and a half, you're locked out. Right. So you only use this if the regular dose that comes through the pain pump is not effective. But most of the time now, before I started really using it, so Dr. Kim was a little concerned, and he said, okay, I'm going to increase your dose in the pump, which he can do. So each time he cautions, he's very cautious, and he guides you through. So in other words, after I had the pump, I saw him, I think, 10 days after. And then I thought, okay, I probably won't see him for a month or two. No, I saw him like another 2 weeks and another 2 weeks. And I'm still seeing him like at least every 2 or 3 weeks. So he keeps a close eye on you after the placement of the pump. And the reason why he does that, he wants to make sure that the medicine itself, it's not too much, it's not too little. And he'll also do an occasional urinalysis. He'll check your urine to make sure that you're not getting too much of the medicine in your system,
Okay.
which I really like. But now is I'm noticing that I don't need all 4 of the extra, what they call boluses a day, that I may only use 1 or 2. So I'm noticing that the strength of the medicine in the pump is working and more effective, and I'm getting longer hours to where I can function.
Mm-hmm.
You only have to refill the pump, I would say, every 3 or 4 months,
Okay.
which is a really advantage because you don't have to worry about going to Kroger or the
Right.
pharmacy and, oh, did he get my script in? I need my meds. And you just go every 3 or 4 months, and it's a quick procedure. I had it done this last month, the first time, well, January, the first of this month. And I was a little nervous. I went in there and he says, okay, I need you to lay face down. And I said, oh, goodness gracious. And I said, okay. And he said, this is only going to take a few minutes. Don't be nervous. Well, you're always nervous when you think somebody's going to stick a needle in your pain pump.
Right.
So it was very, very easy. I really felt nothing. He refilled it and he said, now. I thought, well, I'm not going to see him for 3 or 4 months because he said, we won't need to refill it again until April. And I thought, okay. But he said, I want to see you in 2 weeks. And the reason why is he increased the medicine in the pump. So he wants to monitor me and see, was that too much? Do we still need to increase it more? So that's the real key about a pain pump, is because they'll gradually increase that medicine to where you may not feel any pain at all. I'm sure some people go without any pain, and I do expect some pain because of the degeneration in my neck. And when you have a fusion, you have to remember that even though they fixed C4, 5, 6, or whatever, those little discs above and below still may squeal a little bit, and you may get the degeneration and the osteoarthritis in your joints. So this is something that, you just have to expect, and that's the way life is. But if you can get hours from a pain pump, pain-free, then you should take advantage. Actually, I went to a couple of Christmas programs that my grandchildren were in. These are things that really mean a lot to me, where I can go out with friends and eat dinner and sit there and enjoy company. And I think the pain pump is a great resolution for those that have suffered long term and have been opiate dependent for years. I would highly recommend it. It's everyone's choice. A lot of people are afraid of surgery, but the surgery center, the staff there is excellent. Dr. Kim is excellent, and even though he just may come in and say hello, this is what we're doing today, give the man a chance, because he really knows your history and he knows best what you need.
Absolutely. So you spoke on some of those side effects, the tired feeling, the fatigue, those things that you were experiencing with traditional opiates.
Yes.
Can you tell us, do you have those side effects now? Are you feeling those things now with the pain pump?
It goes to in the spinal fluid, and it affects your central nervous system where all your pain generates. And so it bypasses a lot of those other side effects. Sometimes I do get tired because Dr. Kim also recommended another medicine for me that is a muscle relaxer. So I take that sometimes in conjunction with the pain pump.
Okay.
And I'm still fine with that because it may have side effects, this other medicine, a dry mouth or a little fatigue, but it's short-lived and I can still function, and that's what I need. Last night I watched the IU game, and my little grandson keeps running up. Grammy, are you watching the game? I said, yes, Mikey. I'm switching back and forth. I'm in control. So I was able to, just really enjoy things. Whereas before, and my little grandson wants to start playing football. And, I want to be able to go and to sit for hours.
Absolutely. Well, I'm so glad, again, that this is working so well for you, and this has been such a life-changing experience.
I'm very grateful to Dr. Kim and his staff, both nurse practitioners and the surgery center. I recommend them highly. I just say that a lot of people, when they go to a doctor, sometimes they want, I would say, fluff. And I didn't want fluff. I had fluff. I wanted somebody that was direct and knew what I was going through. And even though Dr. Kim is not sitting there holding his neck like I was, and the base of my skull hurt so bad, but I still felt like he knew, based on my records and my history, I was really hurting.
Well, I'm so glad to hear that, and I'm glad that you pushed through.
I have.
Well, Judy, before we wrap up, is there any advice that you would give to someone that may feel hopeless about their pain, maybe looking into pain management, or someone who may feel nervous about treatment options?
What you need to do is if you research and you go out and you find people that are in your same position, or you read stories, research and go to the right places. Don't go to Facebook, and this person said this. Don't do that. Go to reliable sources that will give you that medical knowledge that you need. That's the advice I can give patients, is to do your homework. Don't just go to a doctor and say, I need hydrocodone and I need morphine. Research first. Know what your options are. Because most of the time, nowadays, there are good medicines out there. And Dr. Kim also recommended that I take Tylenol. Tylenol does work well with this pain pump. I can take a Tylenol and with the pain pump, and I do quite well through the day.
Well, thank you. Thank you again for being here.
Thank you.
Thank you for sharing your story. I know that this is going to affect so many lives.
I'm just very appreciative. And I do have a lot of faith. And I feel like the good Lord helped me find Dr. Kim.
Thank you for watching or listening. If you would like to schedule an appointment with either Dr. Kim or any of our other providers, please visit our website at indiepain.com and feel free to give our social media accounts a follow as well. Thank you.